Hi, I'm Dr. Allison Smith, head of the clinical team here at Precision Analytical, creators of the Dutch test. Welcome to this mini presentation introducing the Dutch dozen. You've heard about it, but what is the Dutch dozen? The Dutch dozen are the key markers on a Dutch test that inform you in a really simplified way of a person's comprehensive hormone story. We want to take something complicated and make it simple. We have created an interpretive framework that introduces these key elements on the hormone testing summary page of every report. On the summary page, you will notice that we feature 3 hormone stories neatly divided. We've got estrogens, androgens, and then cortisol. Within those 3 sections, there are 12 key Dutch test elements that are curated to tell those hormone stories, and we call them the Dutch dozen. Having them all together on the front page helps you quickly gather all of the necessary insights that you need to develop a comprehensive treatment plan, even without turning the page. To make this really simple to implement, each section of 4 elements has its own comments page. And we call it the About Your Results section, and we'll go through each one next. Here's the estrogen and progesterone section of the Dutch dozen, pulls the data directly from the estrogen and progesterone section of the summary page. Very intuitive. The comments are systematically designed to cover each element in really simple language. And you'll notice that, in the patient's self-reported cycle information will be found here. We'll note any hormone medications that might affect estrogens and progesterone, like birth control or menopausal hormone therapy. And then the comments will start to follow. The first comment in the estrogen and progesterone section corresponds to the estradiol level and its relationship to the patient's menstrual status and any hormone medications that they may be taking. The second comment centers on the progesterone level, and here we see progesterone is quite low and suggesting ovulation has not occurred. Phase 1 metabolism is next. Here the 2:16 ratio is low and the 2:4 ratio is also low. Both represent a higher risk, more estrogenic profile, and we do explain in very simple language in this comment what that might mean. And phase 2, COMT methylation activity. For this patient, it's lower than we'd like. So this really gives you a very complete idea of this patient's luteal estrogen, their luteal progesterone and estrogen balance, their ovulatory status, and also their difficulties moving estrogens through phase 1 and phase 2 metabolism, all from this one section on the summary page. So let's look at the androgens next. This comment section similarly pulls the data from the summary page and will comment in simple language if the patient has self-reported symptoms of high or low androgens or is using androgen therapies. You'll find those reported here within the comments. And then we go right into those findings. First, we assess total DHEA production, which is in the normal range. Next, we look at the testosterone level, also in the normal green range for a cycling female. But when we get to the metabolism, despite those normal testosterone and DHEA levels, we do see that 5-alpha androstenediol level is elevated, and this reflects dihydrotestosterone activity in the tissues. Now, 5-alpha androstenediol can be high because you just have a lot of testosterone production, and if that were true, you'd expect to see it with a high testosterone diol, which we don't. In this case, 5-alpha androstenediol is high because of high androgenic metabolism rather than high testosterone production. You would treat those a little bit differently. The 5-alpha metabolism slider confirms that strong androgenic metabolism in the DHEA breakdown. And so reading left to right, we see normal production of androgens, but a highly androgenic metabolism. And again, that makes a difference when it comes to how you're going to treat this patient. Are we knocking down androgen production or are we influencing metabolism? I think it's the latter in this case. So this is the cortisol section. If the patient has symptoms like fatigue or sleep problems, that information will show here. And then we start by assessing the diurnal pattern of free cortisol. So for this patient, it's a bit low and flatter in slope. We then add those daytime points together to get a sum of the free cortisol points, which is pretty low over the course of the day. But the metabolites of cortisol are really quite high, which tells us that total cortisol production is elevated and the body is trying to adapt. Finally, we assess the cortisol clearance rate, which for this patient is quite high because the metabolites of cortisol are high compared to a low free cortisol. That's fast clearance. Notice in the comment, we're pulling in information supplied by the patient to help you pull together possible drivers of some of these abnormal findings. In this case, the patient falls into an overweight BMI, and high BMI is associated with fast cortisol clearance rate. So that's how you use these comments. Don't forget to check for abnormal organic acids for important clues into root causes. Those are also located on the summary page. We have an abnormal oats section at the bottom here with red monikers for those markers that maybe need attention and yellow if some are pushing the edges of their ranges. In this case, we have full-on deficiencies in B12, B6, melatonin. High indican suggests gut dysbiosis or maldigestion, and high quinolinate is your marker indicative of neuroinflammation. So here's the Dutch dozen all together again. We think you will love using the Dutch dozen. It is distilled, it's simplified. You can feel confident basing your assessment on these 12 key concepts plus the oats, and you can get to the fun part, designing the treatment plan much faster. Of course, you can still dig in a little bit deeper with the advanced insights section that follows the Dutch dozen, and it is full of comments that help you go deeper to identify more advanced patterns if they exist. Those deeper level concepts that may not be pertinent in every single case, but those you should consider for some, like the 5-alpha metabolism of progesterone and cortisol, for instance, or abnormal organic acids relationships to androgens and estrogen imbalances, and cortisol-cortisone balance. They're all covered in this section. And similar to the Dutch dozen, they're also grouped by the hormone story to which they belong: estrogens, androgens, and cortisol. Thank you for learning with me about the Dutch dozen. See you next time.